And it was great to see you all moving this morning, because you know that exercise really helps move your lymph, and it's good because it helps take away all the bad things that are sitting around your tissues. Because, as you'll see later on, the lymphatic system's a sewer, and you've got to get that sewage system working right. So this is about understanding lymphatic system, your lymphoedema, risk, and what you can do to make a difference to live well, and that's what's important. Number one, why we have to pay attention to the lymphatic system. It's a sewage system. You know what happens when your sewage system gets blocked? We live in the hills, we only have septic, but that's even worse when that gets blocked. I won't tell you how bad it is. The other thing is that good lymph flow is needed for cell health, okay? Because it's like the room we're living in here today, right now. When it got cold, we weren't happy. When it got too hot, we weren't happy. And same with your cells. They're happiest when they've got the right pH, when they've got the right temperature, and everything is supplied that they need and everything is taken away that they don't need. That's the importance of the lymphatic system. Wherever and whenever you've got slow lymph flow, it's going to make more fat deposits. Okay? So that's because there's factors in the lymph which is saying deposit fat to the adipocytes. So that's why you should keep your lymphatic system flowing. Reduced lymph flow will also mean more infections, because you can have an infection down here and a bug down here, and if it's in that finger there, that doesn't look good. But if it's in that finger there and the lymphatic system's not draining enough and quick enough, those bugs down here are going to proliferate before the lymphatic system can send the defences back to that finger. And the same applies for movement of cancer cells, and recognising that there's a bad cell there that shouldn't be there. Let's get the lymphatic system back down there so there's antibodies and killer T cells that can deal with that cancer cell, or deal with the virus, or deal with the bacteria. Super important. And what that generally means is that our immune system responses are very poor when lymph flow is poor. So to better counteract issues and problems of defence and getting diseases and disorders and stuff, get your lymphatic system working optimally. And here you see a picture of the lymphatic system. I just want to emphasise that it's rather unique. This big picture will show you why you need to think, act and assess holistically. Look at the difference between the drainage system from the left arm and the rest of the body and the right arm. They're two separate systems. You see this again? See the right arm, the right side of the face, a little bit of the right chest, drains into a different pathway to the whole of the rest of the body. So sometimes when you've had a problem up here with the left shoulder, what can happen is you can get a swelling a little bit further down because the lymphatic system drain has been a little bit disrupted into that area. So we always must think holistically when we're thinking about the lymphatic system. And why this big picture? Why did I show that big picture? Well, everyone knows if you've got a bucket full of water, or that container's full of water, and you want to put more water in it, what do you got to do? Empty the buckets. Okay, you can't put water in a full bucket of water. Same happens with the lymphatic system. If we want our lymphatic system to drain fluid from our legs or from our fingers or our forearm, we've got to make sure there's an empty space for it to flow into, which is why you were doing some exercise and activity earlier, to empty out those lymphatic buckets here so that the fluids can move from your arms or from your legs or from your tummy. Super important. Got to create space for the fluids and the bad things in the lymphatic system to flow into so you can get them away. And that's what our therapies do. And Alicia will be talking about some of those therapies later on, because they're aiming at getting the lymphatic system working better. And I must say, this here is really important. That's what you, your partners and your carers are trying to do. Get that lymphatic system working just that little bit better, a little bit faster, a little bit more effectively. We have to talk a little bit about the parts of the lymphatic system, because it's interesting to know. They're divided up into areas called lymphatic territories. That's like our states. Victoria, here. South Australia next door, New South Wales up top. Okay? And there's borders between them, aren't there? Okay? And they're called watersheds. So a state border is like a watershed, which means you live in Victoria, I live in South Australia, I spend most of the time there, you spend most of your time here, but sometimes we cross, don't we? Okay, and that same happens with the lymphatic system. Sometimes one lymphatic system or one lymphatic territory may not be working properly, and to get that one working better, sometimes we have to get the lymph, the people, the cells, to cross the border and go somewhere else to drain out. Does everyone understand that principle? That's really important for us. Here's a picture of the lymphatic territories of your arm. Can you see my red thing here? Okay, that's good. So, everyone is different. These are stylised. No one's territories are exactly like this. There's another name called lymphosomes that you might come across. But look here, up in the upper arm, generally there's 3 territories. One here, medial, one here, anterior, one here, lateral. And same in the forearm. So sometimes one of these territories might have a drainage system that's not working well enough, and what happens? Yeah, you got it. Yes, it swells up. Okay, and the first sign of swelling is fluid, fluid accumulation in the tissues, and you can feel it. So what we've got to remember that there are major lymphatic territories of our arm and our body, and sometimes one of these might not be working properly, draining properly, and the other ones might be fine. And sometimes they all go off in concert when the lymphatic system's damaged a fair bit. Now, here's the organisation of the lymphatic system. What I like you to do in a non-affected arm is just pick up a little bit of skin between your thumb and forefinger. You know, what you've just picked up is all of this here, above the deep fascia. See that? That deep fascia is what's covering your muscles. That's the tough fibrous bits you get on a bit of steak every now and then, or a lamb backstrap or something, okay? You can't pick up your muscles, but you can pick up all the tissues above it. And that tissue that you just picked up is where lymphoedema occurs, if it's going to occur. That's where there may be some differences. Have a look at them, and you see down here on the deep fascia, that's the tough stuff that you haven't pulled away from the muscle. That's where our deepest, largest lymph collectors are. They're the ones that take away all the fluid that leaks out of our blood vessels from up here under the skin, takes it away and empties it into an area up here in the case of our left arm, and up here in the case of our right arm, and it goes back into the blood when it gets emptied. So let's just have a look. You watch this. This is how the lymphatic system works. Looking at this picture, you're going to see why it's important for us to move, touch our muscles, have massage, breathe. See these little fellas here? They're going off into the tissues. And see these little structures here? They're cells that have to be opened and closed to allow all the stuff that's in the tissues to get into the lymphatics to be taken away. The toxins, the waste products, the bacteria, the cancer cells to be taken away by the lymphatics, taken to a lymph node where it says, hey, here's some bad stuff. Let's destroy it. Let's get to it. So that's why lymph flow is important, to get rid of all the bad things in your body. So let's have a look at this picture. This is how your lymphatic system is working in your body right now. Okay? Once the material's in the lymphatic system, here it goes down deeper into the tissues. Deeper, deeper, deeper. And eventually we get down to the spot where, look, there's muscles. Can you see the muscles? They're pulsating around the lymphatic vessels. And all of our lymphatic vessels right now are pulsating about 6 to 10 beats per minute. 6 to 10 beats per minute. How fast is your heart beating right now? How many beats per minute? 60, 70, 100 if you're really excited. If you were watching Ian this morning, you'd be up 120. He's an interesting fellow. Okay, there it is again. That's what we have to do. And we have to get that functioning well. We have to get that stuff into the system and get rid of it. Now let's have a look at the big picture. Here's the big picture. Okay, we're going to watch this picture and see going from the big picture of the lymphatic system all over the body to that little picture that you just saw. So have a look at this. This is all in perspective. Here we go. Going to go and have a look in the left arm, under the skin, going into the body, having a look. Here we are, under the skin. This is the part that I just showed you about. Here we are. We're now going to look at the uptake vessels. This is what takes all the waste products out of our tissues, into the lymphatics, down deep into the tissue, and then these big lymphatics called collecting lymphatics are moving along just above our muscles. Okay, is everyone clear about that? That's our sewerage system. That's working well. Now, you see them working there, 6 to 10 beats per minute. That's why when you're doing exercise and activity, there's no point doing it quickly. Just do it slow. That's why Tai Chi, Qigong, and yoga, and those sort of things are good because they're nice and slow. They're very slow breathing, slow acting, and so is the lymphatic system. Now, let's have a look at what puts a load on your lymphatic system, because every one of these represents a leverage point for you, okay? And it's for all of us, okay? It's not for those who have even got a risk of lymphedema. We just want to actually keep the lymphatic system, the sewage system, working as well as we can. Blood capillary pressure. Who knows what your blood pressure is like on average if it's in healthy range, roughly? 120 over about 80. Perfect, absolutely perfect. If I had prizes, I'd give you some prizes, but maybe Isabel's got a prize up there at the back for you. Okay, so pressure. So that already tells you If you're a little bit hypertensive, got high blood pressure, it might actually load the lymphatic system. So get your blood pressure checked every now and then. Vessel leakiness. What do you know about that? What's a sign that your blood vessels are leaking? Bruises. Another prize. Isabel, second prize. Bruising, okay? That means your blood vessels are leaking, and you can stabilise them, you can make them a bit stronger with things like Bruce-Ease and Paraffin Fort and all those sort of things. But talk to your therapist about those things. The next thing which determines our load on the lymphatic system is proteins in the tissues, big molecules in the tissues. And the quicker we can get rid of those big molecules out by the lymphatic system, the less likelihood there is for fluid to stay around in the tissues. That's why we've got to get our lymphatic system working well. And Sarah, you crossed your legs, and you should never cross your legs because that's not good for lymphatic drainage. And I'm going to show you later on if I got time. Okay, the next thing is number of active capillaries, okay? And that's our whole, every single muscle, if I'm doing lots of this, I've got lots of capillaries now active, our blood capillaries are active. And if I stop dead, not literally, but if I stop quickly, right now there's lots more fluid leaking out of my blood vessels and a load on the lymphatic system, which is why in dragon boating and every other sport, you need to warm down or cool down slowly. Don't stop quickly, because then all that waste products from the cells will be accumulating in the tissue and you're not helping it move. Okay, warm down, always warm down, cool down slowly, whatever you want to call it. Fats in your diet, they're really important because there's all sorts of different fats. Long chain fats, middle chain fats and short chain fats. Long chain fats have to be absorbed from your tummy via the lymphatic system, which puts more of a load on your system. Mid-chain fats and short-chain fats can go straight into the blood vessels. Okay, really interesting differences there. Some medications, for instance, calcium channel blockers called CCTs, can actually add load to your lymphatic system. So talking to your GP about those sort of things, or your specialist about medications, and are they likely to make my lymphoedema worse or my edema worse? Because a little bit of tweaking of those may make a difference to what we're focusing on, lymph load. Now, let's have a look what determines lymph flow. What do you think is the main thing that determines our flow of the lymphatic system? Movement, yeah. And the other one is load. The more we put into it, the harder it's going to work. There it is. Get the stuff out of the tissues into the lymphatic system and it's going to carry it away, okay, if it's got an opportunity to do so. And the other thing that determines lymph flow is the rhythmicity of the collectors. They're all beating. You saw them beating like this, didn't you? 6 to 10 beats per minute. They'll beat faster if you put more into them. Activity of nearby skeletal muscles. What I'd like you to do now is just do this with your arms. Just nice and slow, not quick. There's no point in doing it quick. Your muscles now are massaging your lymphatics and helping lymph to flow out of your arms right now. Okay, getting rid of all those wastes, all those toxins. Have a deep breath in. Breathe in. Now breathe out. You've varied the pressure in your chest and your tummy. That's how you got air in, okay? By doing that, you've also varied the pressure around your lymphatics in your tummy, down here, and your chest. And by having a negative pressure here and a positive pressure here, what happens? Lymph comes up your legs or out of your arms if it's negative pressure in your chest. Okay, if it's positive pressure, lymph will go out of your chest into your major lymphatic drainage pathways. So that's why having a good breath, nice deep breath, is really important. Don't just sit there like you're sitting at a computer or playing a game. You're not breathing properly, are you? Get there and have those nice deep breaths every now and then. They make a huge difference. Pressure exerted by surrounding structures. Really important.
Pressure.
Pressure. And pressure exerted by applied compression. Who knows who did this song? Surprise! No one? All right. No. All right, no prizes then, sorry. Okay, you do have to watch out for pressure. I'm serious about that. You have to watch out for pressure, too high a pressure in the wrong place. For instance, bra straps and those sort of things, or underwear and the like. I've got my pressure monitors, but we may not have a chance to do that. But watch out for external pressure, constant external pressure that's in the wrong place. If it's variable external pressure, it's fine. because if you're moving, the pressure varies. But if the pressure is constant when you're not moving or you're immobile and it's the wrong pressure, that could be bad news for your lymphatic system. Okay, just remember, the lymphatic system's low pressure, not like blood pressure, small volume, 2 to 4 litres per day, slow flow and slow acting, but it's absolutely essential for a good immune response and for good health of your cells and tissues. So we've got to keep it going. So, and as far as we're concerned, we want you to stop from ever swelling in your body, even getting a chronic edema, but we want to stop you from getting lymphedema by making sure your lymphatic system is working good. Okay, in a normal arm, the amount of lymph fluid leaving it is 100 mils. Okay, 100 mils, that's not much, is it? What do you got in those? You've got 200 mils in those glasses. So half of that is what's leaving your arm in a day, 5 mils per hour. But if I've got a red cuticle around here, or an infection here, a little cut or a scratch that's not been attended to, that's an extra 5 mils per day. 5 mils extra per day, if it sits around in the tissues, do I know there's 5 mils there at the end of today? Probably not. What about 5 mils every day for a week? 35 mils. Do I know there's 35 mils? That's two spoonfuls of fluid sitting around? Yeah. Leave that around for a month, 35 mils for a month, at 5 mils a day is roughly 140 mils. Okay, you've got the beginnings of a swelling. So the big thing is, little things make a big difference with the lymphatic system. You can do a small thing that'll make a difference. Just remember, when lymphedema occurs, this is when it basically occurs, and there are 3 reasons why it occurs. Number 1, the lymph vessels are necessarily removed with the lymph nodes associated with cancer surgery. And I have to say, our daughter's had cancer surgery. She's had radiotherapy, chemotherapy, 2 surgical interventions. And she's gone through all of this stuff, and I've got to say, she's published it. She's presented her life story and got it published in an international journal. So likewise, if you've got a story you want to get published and want other people to read and learn from it and benefit from it, to know they're not alone, please maybe approach Isabel or someone in the BCNA, and then they'll talk to me about it, and we'll see if we can get it published in a journal for you. I'm an editor of lots of journals, by the way. So the other reason why you may have lymphedema is the collectors are damaged or constrained by fibrous tissues which occur after radiation treatment. It's getting better with targeted radiotherapy, 3D radiotherapy, but it's still a problem sometimes. Or we may have an underlying genetic issue. You can't beat your genes. If there's not enough lymph vessels, or there's a low pump pressure, they can't pump properly, then you're going to end up with a bit of a problem. So you have to acknowledge genetics. But they're the 3 reasons why lymphedema occurs. Let's just have a look at surgery and radiotherapy. I just show you the picture of what happens when a surgeon's knife goes through. See what happens? They cut a lymph vessel necessarily. But you see what happens here? Look how immediately, most often, a new pathway will open up, because the lymphatics are richly anastomotic. It realises when one path's destroyed, let's open up a new pathway. And that's the idea of therapists. That's what lymphatic drainage therapy is all about, opening up new pathways, finding new places where it can go. Likewise here, if fibrosis builds up in the tissues, this is what happens. Look at all those fibres building up in the tissue here. They're a little bit dark here in this picture. As that builds up, can you see that stops these lymphatic collectors from pulsating? They can't pulsate, they can't do their job. So that's why you've got to watch out for fibrous tissue. You have to have radiotherapy, you have to have surgery to protect you from cancer, but the effects on the lymphatic system can sometimes be problematic, but they're all manageable. Okay? And where does lymphedema occur? It occurs in this area that you just picked up earlier. Okay? And you might like to, if you want to compare one arm with another, you can see in the same area that there may be differences in thickness of the tissue you pick up. I've got differences because I'm left-hand dominant compared with right. But that's where it is. It's mostly superficial, above the deep fascia, above the muscle. And that's why it's easy to get to from the therapeutic point of view. And that's why it's sometimes a problem, because it's there and it's observable. Now, I want to emphasise, not everyone is going to develop lymphedema after treatment for breast and other cancers. And if you had a whole axillary clearance, about 18 or 20% will have a 5-year risk, but it's a lifetime risk as well. But 2 or 3% if you've only had a few lymph nodes taken out. And 2 or 3 is not much. But even if you get lymphedema, its early detection and management will mean you won't actually get it as such that it's a big arm or a difference in the arm. That's why being proactive is really, really important. So assessing risk is very important, and you see here Monique Barham, who won SA's Local Hero Award, and she's a lymphedema advocate, and she's making a world difference to lymphedema, especially around South Australia. Assessing risk is important. Okay, this is for someone who doesn't have lymphedema but is worried about getting it. What's my risk of getting it? And there are risk assessment forms down the back there, I think next to Isabel, and you can just tick them off and see what your risk factors are. Some of them you can't control. Some of them you can control, and if you can control a risk factor, talk to your health professional about it, how they can help you, or you can maybe just do it yourself in terms of skincare and those sort of things. Let's just look at some risk factors. Skin quality, okay? A good quality skin. Have a look at your nails, have a look at your cuticles. Is there any redness? That might be that 5 mils per day. Cuts and scratches, that might be that 5 mils. Watch it. High blood pressure. If it's 140 and above systolic pressure, maybe a medication to reduce that a little bit might help, or look at the events that have caused you to get high blood pressure. Strength of small blood vessels, like I said, there's some bruises and all sorts of other things can help stop you from bruising and help make your blood vessels stronger. Watch out for infection. Get onto infections, get onto cuts really early and scratches really early with some antiseptic cream. Watch your weight. One of the prime determinants of lymphedema occurring is excess body mass. Okay, that's because you've already got fat cells that are stopping the lymphatics from working properly. And when they can't work properly, the whole cycle goes around and around and around. Fats in the diet and the venous system. I won't worry too much about that, but sometimes your blood vessels, your veins, are not working properly, and that puts more load on your lymphatic system. But anyway, what I want you to think about and know about is the risk factors. Here's the ones that you've got lots of managed controls over. Okay, you might better modify them in conjunction with a therapist and make a difference. But what you have to do also, how long have I got? Who's in charge of time?
About 15 minutes.
Is that total, including questions, or?
So.
That includes questions?
15 including questions.
Okay, right, here we go, folks. Okay, so
Sit tight.
sit tight. I'm standing. I won't stand for that, I could say, but I am. Okay, so make sure that when you do see a therapist, that your therapist is well informed and you tell them everything about the family history, medical history, surgical history, current medications, because that's going to allow them to make a better decision. You've got to be in concert with your therapist. Why is it important? Because you will know you've got some other problems, maybe with the thyroid, maybe with your blood pressure, maybe with your blood vessels, maybe with a kidney or liver, maybe you've got some problems with those. Sorting those out can really help reduce your risk of getting lymphedema, okay? And you should be sorting them anyway. So just remember, in terms of diagnosis, there are all sorts of different things we can use to diagnose accurately whether you've got increased fluids in your tissues. Bioimpedance, tissue dielectric constants, tonometry, ingerometry, pyrometry, they're all clinic-based, but there's some simple stuff you can do. You can actually look for positive stematocytes, or your therapist can do that. That's the inability to pick up a bit of a skin fold here on your fingers, or you can do it in any lymphatic territory. Can I pick up a bit of my skin? If so, that's a negative stematocyte. If I can't pick it up, it's a positive sign, and a positive stematocyte is a sign of build-up of fibre in the tissues, fibrosis, and that's not good for the lymphatic system. So those simple stematocytes is good. Likewise, the pitting test. If you think you've got fluid in your tissues, push your thumb down for around about, ideally they reckon about 90 seconds nowadays. Push your finger down in the tissues and see if it leaves an indent mark. If it does, then there's a little bit of fluid there. Maybe it's time to go and see your therapist and see why that fluid is there, because that might be an early sign. There's also lots of telehealth and other apps available. Talk to your therapist about them. There's this one here, Lymphatic. There's about 10 or 12 different apps available around the world where you just hold your phone up to your arm and it'll take some measurements, or you can put some data in there, see how you're going, and you can actually just get a continuity of care feeling and good feelings about how things are changing. Remember, don't be like the old GPs that we always talk about. What did they used to do? They used to say, oh, let's wait and see what happens. That's being reactive. That's reactive healthcare. We can't do that anymore. We have to be proactive. We want to stop you from getting something. So the moment something's detected as being different, get in there and minimise it before it becomes a problem for you, okay? Little things make a big difference. 5 mils per day in the lymphatic system. There's also help online education programs available, which I'm involved in this one with Monique and some others, but it's whatever suits you. Now, I just want to say a few things in my last 3 minutes, 20 seconds about key treatment and management areas, and Alicia's got to say something about some of these. Compression, positive pressure, but negative pressure. What's an example of negative pressure? You just done it. You just breathed in. When you breathe in, why does air go in? Negative pressure, okay? So you've done some negative pressure, but other things are kinesiotaping and a whole pile of other stuff. So don't think of pressure as always being positive. It can be negative. A whole range of lymphatic drainage techniques, skincare, activity, exercise, breathing, water-based programs like the Encore-based programs. If you're in there, just think about where your lymphatic vessels are when you're moving, and if you're standing in water and you put your arms down in, the pressure on your arm is more when the arm is further in the water, okay, and the external pressure is good. So just think of those sort of things. They're the key treatment and management areas. Lymph taping, skin care, exercise, diet management, weight management, water-based programs. But my key message today is this. We must target and sequence the treatments based on a good quality assessment. Look here, this is what's happened when you've had surgery or radiotherapy. You've got lots of scar tissue, you've got lots of damage in the tissue, okay? Necessary damage, but that lymphatic system can't grow through there. So what do we have to do? We have to break up the fibrosis first, okay? You can't expect massage to open up pathways and work through there. So you have to break up the tissue. That's why targeting and sequencing is important. And in this case, if there's lots of fibrosis, it's laser treatment or massage therapy, which is across the grain of the fibres, or Bowen therapy, or maybe something like that, which is going to help the fascia get looser. Because remember, lymphatic pressures are low. What do you reckon the pressure is in our lymphatic vessels up here in the shoulder right now, in all of you? How many millimetres of mercury? Blood pressure? You said it was 120 over 80. What do you reckon lymphatic pressure is here right now? Pardon? Yeah, it's getting close. 10 to 5 to 2, okay? It's not real high, so it doesn't take much to block it. But our lymphatics can pump up to about 40 millimetres of mercury sometimes if they've got a blockage, okay? So they can overcome blockages, but not if it's a constant blockage. So you've got to have a watch out for that. So the most important message is here, simple actions can help your lymph flow. Deep breathing, just do it right now. Nice slow deep breath in, and then just breathe out. Okay, we show it to the patients in our clinic where that will take away maybe 20 or 70 mils of extra fluid from your arm after doing it 5 or 6 times. Okay, it's a world of difference, it helps. Okay, remember though, emptying the buckets is important. You can't put water in a bucket full of water. So if you've got a garment on, before you put it on, empty the buckets up the top of the arm by breathing. Before you take it off, empty the buckets, otherwise what's going to happen? The water, the fluid, the lymph is going to go back into the arm again. Okay, so always remember that sort of thing. Okay, that's the breathing. Interesting stuff. And what I'd like you to do now is just move your muscles. Oh, you're getting anxious. So I'm 2 minutes away, promise. Move your muscles like that. See, that's what you're doing. See the muscles underneath here are moving, and that's what you're doing when you're moving your muscles. Okay, and that's what's really important. Move the muscles because it helps the lymph vessels to pump and to get the fluid out. Aqua-based therapy, of course, like the Encore programs, I've talked about that. But what we have to remember is these things may interfere with lymph flow. Shallow breathing, constant pressure in the wrong place, bra straps, for instance, side panels, under wires, absolutely critical that you get them fitted properly and you're sure about the bra is appropriate for you. Just remember, it doesn't take too much effort to actually make a difference to this 5 mils per hour, okay, 100 mils per day. Small things make a big difference, and being confident is important. That's number one, being confident that you're doing something that makes a difference. So here are the most important things. Early intervention, early identification is important. Be proactive, not reactive. Okay? Make sure you know your role, you know what you want. Some people might want a reduction in the size of the limb. Some people might want more functionality, more mobility. Some people might want less tingling. Make sure your therapist knows what you're chasing. But always think, assess, treat and manage holistically. Super important. Okay? The most other important things are those 3 things down the bottom here, like I just said. Know what you want, know what you can or will be able to do, and please, only one thing different at a time. It's called an RCT of 1, randomised controlled trial of 1. If you do 10 things different at a time, how do you know which one works? You don't, and you're wasting money probably, but be careful, one thing different at a time, and there's a lot of stuff out there. Try before you buy it, please. Rent it or borrow it. See how it works for you, because not everything works for everyone. Question and answer time. Number 1, work and think holistically in a partnership. Thank you for watching and listening.